This presentation is connected with a large grant on behavioral health, which is called CAPE, and CAPE stands for Community Assessment and Education to Promote Behavioral Health and Planning. Asa Dembele has served as a research assistant for the center here on the CAPE project, and has been working with Scott Loveridge, whom I think many of you know had served as director of the NCR CRD for many years, and you can see that he hasn't gone away. He's just shifting his roles. So welcome back to the webinar, Scott, and welcome Asa, and thank you for doing the survey. The webinar. So the title of the webinar is New Evidence for Risk Factors, looking at the different factors that play into a person's perceived mental health and mental wellness. And so with that, I will hand it over to Asa and Scott for the webinar. If I see something down in the chat section, I may intervene here and let you know there's a question. For the audience, if you have any questions, you can write them in the chat section, and we'll try and catch them either along the way or near the end of the webinar. So with that, I will stop, and Scott and Asa, again, thanks, and looking forward to your talk.
I think we're going to just ask people to fill out these polls real quick, and then we'll return back to them in a few minutes. So if you haven't done the poll already, please do so. It looks like only one person has done both of them. So why don't you go ahead and do them, and then we'll get going. Okay, good. Why don't we go ahead and get started then?
Okay, my name is Asa Dembele, and as was mentioned, I'm a research assistant for CAPE. And welcome to my presentation, and thank you for spending your lunch hour with us. And with that, I'm just going to jump right in. So the title is Poor Mental Health Days, New Evidence for Risk Factors. And before we get to the presentation, I'd like to thank our project partners, which are the Substance Abuse and Mental Health Services Administration, the USDA, National Institute of Food and Agriculture, and the Regional Rural Development Centers. So the plan for today is I'm just going to start with the introduction, move on to the model, data, results, and finish with the conclusion. Mental health is an important aspect of a person's overall health and well-being. We all know that and can relate to that. But mental health is defined as an individual's ability to negotiate the daily challenges and social interactions of life without experiencing undue emotional or behavioral incapacity. Poor mental health is an issue that comes at high social and personal costs. Mental health is actually one of the Healthy People 2020 leading health indicators. We know that 32% of the U.S. population are affected by mental illness in any year. And depression alone is one of the most burdensome diseases, as rated by the World Health Organization, and is expected to become the leading cause of disability in developed countries over the next 15 years. It affects families, social relationships, education, and productivity. We know that a person's mental health affects their overall well-being, and poor mental health does not only affect their own health negatively in the moment they're experiencing it, but poor mental health can have persistent effects because a lot of mental health issues have chronic and recurring issues. They often affect family and children of the people affected as well. So effects can carry over into the next generation, and it also affects a person's productivity and again, not just in the moment they're experiencing it, but it can often have persistent effects on a person's lifetime educational achievement and career opportunities. So people often experience long-term effects of mental health issues. Again, there are high social costs. There are over 30,000 suicides a year in the United States. And there are lots of social issues connected to poor mental health, as well as economic issues due to lost productivity, due to lost lifetime productivity. And lost productivity doesn't only refer to people not showing up for work because of their mental health issues, but there's a large issue with presenteeism, which is what we call it if people with poor mental health do show up to work, but have reduced productivity at their job because of their mental health issues. So we know this is a problem with potentially far-reaching consequences. And as you can see in this graph of poor mental health days, which is the main variable of interest we are looking at in this study, you can see that poor mental health days have been increasing since the behavioral risk factor surveillance system first started recording them, and the trend has been steadily increasing. And perhaps you've heard that about that recent study out of Princeton University that came out in November last year, which showed that mortality and morbidity among middle-aged whites in the U.S. had been increasing at an alarming rate, and while it had been decreasing in all other developed countries. And the driving factor behind that increase in mortality and morbidity was suicides and alcohol and substance abuse, so mental health related issues. And these also have been increasing over the same period. So we know the issue is not only potentially far-reaching and pressing, but it's also getting worse. We know that there are a complex interplay of factors at work that affects a person's mental health. There are individual factors such as genetic and biological makeup of a person. There are genetic markers that predispose people to certain mental health issues and that make them more or less vulnerable to stress. There are experiences such as growing up with abusive parents or experiencing a traumatic event that can trigger mental health issues. The situation or life circumstances a person finds himself in can also affect their mental health. For example, people living in poverty or having stressful jobs are exposed to stress, and we know that stressful life events and chronic stress are an important, if not the most important, factor in many common mental health issues. such as depression, anxiety, even schizophrenia can be triggered or made worse by these. On the flip side, a happy marriage, for example, can make some of these issues less severe. And finally, a person's environment, their surroundings, play an important role. For example, we know that people living in poor, unstable, urban areas are more likely to suffer from schizophrenia, and this cannot simply be explained by people with certain mental health issues being poorer, or just by their personal factors, but it goes beyond that, and there are factors beyond that at play that are potentially caused by their environment. All of these factors interplay and act together. For example, stress and experiences can trigger the genes I talked about earlier and trigger responses in the brain. The environment can either mitigate or worsen a person's mental health. For example, an environment can be stressful, or an environment can dampen some of these effects. When I talk about the environment, I'm not only referring to the natural environment, but also to the physical built environment, like I mentioned, and urban areas have higher rates of schizophrenia and other mental health issues. The family environment, the community environment, the social environment, people who have good social support or live in an area where social fabric and the social network are intact are more protected against some of these factors. And stable neighborhoods seem to be more conducive to good mental health. In this study, we focused on the economic environment. For example, factors such as unemployment, poverty can affect people, and they can affect people directly, or they can affect the social environment. For example, by improving the social fabric of an area, or by making it worse. So there's an environmental hypothesis that a person's environment is an important factor in their mental well-being, and that goes beyond what a person is as an individual experiencing, and that there's actually some sort of network effect or social effect going on. And this is important because it means that if we treat people for mental health issues and their environment remains the same, the treatment might not be as effective. In fact, we know that for depression, there's research that for depression, social interventions often work better than just individual therapy. But for us, from the community health perspective, the most important point is that we could possibly prevent large numbers or improve large numbers of cases with environmental interventions rather than having to target each person individually. That doesn't mean we could necessarily cure them, but we could improve people's lives by improving community level factors if the environmental hypothesis proves to be true. So the goal in this study was to examine several individual and community level risk factors for mental health, and then test the environmental hypothesis for county level economic factors. Moving on to the model. The dependent variable we looked at was poor mental health days. And what that means is the question that was asked to respondents in the Behavioral Risk Factor Surveillance System survey was for how many days during the past 30 days was your mental health not good. And this included stress and emotional problems. Now, this is not a diagnostic definition. It doesn't ask about any defined syndromes such as depression, but it's still a useful indicator because we know from the productivity and mental health research that people who experience subclinical mental health issues, for example, they might experience minor depression rather than major depression, or they might experience symptoms at a lower than clinical level, or they might experience not all the symptoms necessary to be diagnosed with a specific mental illness. Those people can still experience the same level of impairment that people with a diagnosed mental health issue do. And on the other hand, we know that stress and emotional problems are also some of the most important risk factors and precursors for later mental health issues. So it's still a useful indicator. And also, as I mentioned earlier, actual mental health issues and mortality related to mental health issues, as well as other comorbidities, have been increasing at following the same trend that poor mental health days have over the past 20 years. So it's still a useful indicator to look at. We included health-related control variables because general health and mental health have been shown to be closely related. So these include general health, whether a person had health insurance, when their last checkup was, their weight, whether they exercised, whether they had a disability, and whether they had ever been diagnosed with depression in their lifetime. The demographic factors that we included were gender, age, marital status, race and ethnicity, and veteran status. Socioeconomic factors we included were education, income level, employment status, and then the community level factors we included were unemployment rate, median household income, income inequality, and urbanization. This last indicator is based on the rural-urban continuum code provided by the USDA, which designates an area's ruralness or urbanness, and ranges from completely rural to metro areas with over 1 million inhabitants. And in our sample, we barely have any rural areas or any completely rural areas, but I will show that to you next when we talk about the data. The data we used came from the Behavioral Risk Factor Surveillance System, which is an annual phone survey carried out by the CDC in all 50 states, and from the 2012 American Community Survey, which is conducted by the census. The respondents in our data set were over 18 years old. We included respondents from counties with over 1,000 inhabitants, and for this reason, 72% of the respondents lived in metro areas and only 2% in completely rural areas, and the rest anywhere in between. So this analysis is based on over 2,000 counties and over 300,000 people. And here you can see the counties that were included, and the most rural areas of the U.S. are not included, basically, due to this limitation that we could only include counties with over 1,000 inhabitants. This is an overview of the average poor mental health dates per state in 2012. And just from eyeballing, you can already see that there is some geographical variation. So maybe there is something to that environmental effect. On average, people experienced 3.9 days of poor mental health, and 36% of the respondents experienced at least one poor mental health day. Here you can again see the overview. The average person experienced 3.9 days, 36% experienced at least one poor day, and 12% experienced at least 14 poor mental health days. And this is defined as frequent mental stress. Moving on to the results. I'm just going to present some selected results that were significant and also meaningfully large. As you can see, regarding the health status of people, better health was related with fewer poor mental health days. So compared to a person with poor health, poor general health, people with excellent health had 74% fewer poor mental health days in a month. People with a disability had 55% more, and people with depression, as could be expected, had a lot more poor mental health days. In terms of demographics, women experienced more poor mental health days, and this is in line with prior research. The incidence of poor mental health days dropped by about 2% per year of age. Separated, divorced, or widowed people experienced more poor mental health days compared to people who are married in a non-marital relationship or who are never married. And college grads also experienced fewer poor mental health days compared to people with just a high school degree. In terms of economic factors, people who are out of work experience about 30% more. People who are out of work for the short term experienced a little bit more poor mental health days than people who were long-term unemployed. Retired people experienced fewer poor mental health days, and compared to low-income people, people in the middle-income group, which was defined from 25,000 to 75,000, per year experienced fewer poor mental health days, and people with high income over $75,000 per year experienced even fewer poor mental health days. Okay, so I don't know if you can see these results of the poll. Is this obesity?
I think you want the obesity one, right? Yeah.
Yes, that's the one I want. Okay. This is one of the results I wanted to highlight in this talk, the relationship between overweight and obesity and poor mental health. And all of you replied in our poll replied that obesity makes mental health worse. So let's see. We did find that overweight and obesity increased the incidence of poor mental health days a little bit for the respondents, but after controlling for general health, people who were overweight or obese actually experienced fewer poor mental health days. That means a person with the same level of general health, if we compare two persons with the same level of general health, the heavier person actually did not have poorer mental health. They were a little bit better off. The measure we looked at was BMI, which is weight in kilograms over height in meters squared. And these results on this table you can see are compared to the normal category, which ranges from 18.5 to 24.9. And you can see that all the overweight and obese categories, even the obese category 3, experienced slightly fewer poor mental health days. And just to see this again in a different way, to make this clearer, up here we have the results before controlling for general health and after controlling for general health. Overweight and obesity actually did not lead to poorer mental health. People were slightly better off. In terms of the community characteristics, which here we go. Why not? Where did the poll go?
It should be. I'm seeing it. So
okay, good. I'm not seeing it, but if you're seeing it, then that's fine.
I'm seeing it as well.
Good. So I think all of you.
Yeah, everybody thought inequality makes mental health worse. So everybody who answered thought inequality makes mental health worse.
Okay, did you remove it? Okay, thank you. And that's actually what we found as well. So I see that a value is missing here. The unemployment rate increased poor mental health days by 3% per percentage point. And the Gini index, which is a measure for inequality, which ranges from 0 to 1, increased poor mental health days by 1% per percentage point. So what this means in more relatable terms was that a person living in the most equal county experienced one poor mental health day less than a person living in the most unequal county. So that's quite interesting because it relates, these results tell us that economic characteristics do play a role. And also, we controlled for income level as well, for median household income level, and that effect was extremely small. And we could show that inequality is actually more important. This was particularly true for people in the middle and high income categories. That means that people who live in better off counties and richer counties are not necessarily better off unless the county is also an economically equal county. In terms of rural versus urban areas, compared to metro areas with over 1 million inhabitants, people in metro areas with fewer than 250,000 and people in non-metro areas with fewer than 250,000 inhabitants were a bit better off, and people in non-metro areas of fewer than 20,000 inhabitants experienced about 10% fewer poor mental health days. And for the other categories, there was no difference. Again, we had very few rural and completely rural counties in the analysis, though. Oh, there it goes. Unemployment rate was 3%. Moving on to the conclusions. So, in summary, traditional individual level factors were confirmed. All of the individual factors that I showed you have been found in similar ways in the prior literature. Something new that we found was that overweight and obesity is associated with fewer mental health days when we control for general health. So it's not obesity or overweight itself that makes people unhappy. We found some evidence for the environmental hypothesis. and when it relates to economic factors as well. And we found that income inequality is more important than income level. This means that higher weight itself does not lead to lower mental well-being, as I've said. And if people with higher weight experience more poor mental health days, then that comes from the relationship between higher weight and health, and general health. Changes in the economic environment may impact mental health, and raising average incomes by themselves without addressing inequality may not work. And as I said earlier, people in higher income groups are particularly affected by this inequality effect. So that actually means that as people move out of poverty individually, this affects the effect of higher income on mental health, which makes it better, is dampened if there's inequality present. Lastly, I would like to show you our CAPE Behavioral Health Programs database, which you can find on the NCRCRD website. And I've included the link on the contacts page as well, where you can search for programs and interventions by keywords and the population you want to target and the type of intervention. I want to give a quick image credit to freepik.com, where we got all the images in this presentation from. And if you would like to contact any of us, here's our contact information. And again, here's the website with the Behavioral Health Programs database. Thank you very much for your attention. And if you have any questions, please go ahead and ask them now.
Yeah, I'd be very curious about the audience's reactions to the finding about obesity. As far as we can tell, that's new in the literature, and be curious as to people's thoughts about how that comes to be. Is it just kind of Santa Claus kind of thing, fat and happy, or is there something else going on there? So any thoughts you have about that would be really interesting.
Well, this is Mark. While people are maybe writing in their chat question or response to your question, Scott, I was wondering if you have in your database anything about amenities or environmental quality. The reason I'm thinking of that is because one of the CAPE communities that we were surveying behavioral health outcomes in was Flint, Michigan, and so when when the water crisis really started to become public and people understood what was happening, the stress levels and concerns really rose a lot. And I was just wondering if you could incorporate easily some of the sort of environmental quality or maybe even other types of amenities that may affect one's perceptions of well-being.
I actually ran the analysis before with including number of sunshine days and also including lead pollution levels, and both of them had a small significant effect. So sunshine days reduced the incidence, and lead pollution levels increased the incidence. However, those were the lead pollution levels were airborne lead pollution levels. So perhaps I've been trying to find data on lead poisoning levels in children, and perhaps we'll include that to see if that has a bigger effect.
Thank you.
In terms of the interesting obesity result, we found I also wanted to mention that it affected women more than men. It was more significant and larger for women. Interpret that as you will.
Well, I don't see anybody typing questions or responses. So Scott and Asa, do you have any other remaining comments or remarks?
Well, Jen is typing.
Oh,
No,
she
she's
is,
not.
okay.
She was typing. I mean, she's not now. So, oh, there you go.
There it is.
Okay, so the question was, did you do any research on the validity of the Poor Mental Health Days indicator? You mean in terms of getting at mental health? No, it's just an indicator that is used by the Behavioral Risk Factor Surveillance System and has been used in there and the CDC research, and is an indicator that many states use as an surveillance method to look at people's mental health, but I haven't compared it to any diagnostic measures other than, as I mentioned, that it followed the same trend as more diagnostic indicators.
So I'm wondering if the obesity thing might be you know, kind of an indirect measure of the person's you know, whether they're sort of internally directed or externally directed. You know, if you're externally, you know, if you're sort of always worried about what everybody else is thinking of you, then it seems like obesity would really sort of make you feel bad about yourself. But if you are less worried about what others are thinking about you, maybe you're just comfortable with yourself, and maybe somehow that's picked up, and people enjoying life a little more and eating a little more. I'm not sure, but it's really an interesting result. So interested in hearing from others. If you have anything for us, maybe just send us a note if you think about it in the next couple of days.
Yes, I agree that that is the explanation that has crossed my mind as well, that people who are overweight and happy, quote unquote, might worry less about what other people think of them and about their experience, about their appearance, and appearance, or worrying about appearance, can also be stressful for people. So maybe that is what is behind all of.
Yeah, I had a thought. I wonder if there's any kind of interaction between age and weight. It may be that as you get older, it may not be as important a factor, but when you're younger, it might be. I don't know.
That's a good point. I hadn't considered that, but I will test for that. Other than that, I also only would appreciate it if you have any notes or thoughts, if you could contact us, that would be great.
And there's one more comment by Jen, where
that's a great comment. We could add a variable in there in terms of county level obesity.
Oh yeah, thank you. That is great, actually. Yeah, good idea.
Yeah, sort of the relative,
Yes,
your relative position. For those of you who are participating, we really appreciate your feedback. So you can see there's an evaluation here. Asa and Scott, thank you very much for the insightful research and your presentation. It's really great.
Thank you.
Okay, so with that, we'll go ahead and sign off and get back to all the other things we have going on today. Talk to you soon. Bye.